You are watching the Doctalk show.
Time immemorial, our grandparents have known that eating certain herbal products or plant products can actually cure you of diseases. We want to know whether this is true for things like garlic or lemon or tangauzi. So, Dr. Christine, what's your take on that?
So garlic, lemon, tangauzi are very healthy options. They're healthy foods. They may even have some antimicrobial properties. They help mop up certain what we call free radicals. So in the body, when the body is going through all its processes, we tend to produce some toxic particles in the blood. So a lot of these things like garlic and tangauzi come and mop them up and remove them from the blood. However, that is what happens in the body, and they support that removal of toxic substances from the body that are made by the body during the natural processes, but they do not actually kill the virus. So drinking tea with garlic or tea with tangauzi it makes you feel very nice. You feel decongested, you feel warm, and it might actually make you feel better, but it's not going to kill the virus.
So what cures the virus then?
So currently, evidence now, there is no cure for coronavirus.
Okay.
There are many drugs that are being tested. I'm sure you've seen a lot on social media. There's chloroquine, hydroxychloroquine, there's remdesivir, there's lopinavir, ritonavir, which is used for treating HIV. There are very many drugs that are being tested, but evidence now, as we stand, there is no drug that can cure. There is some evidence, and Pauline can probably add, about how these drugs can help.
Really?
Okay.
So,
so maybe back to the herbal, the lemon and
the lemons and the garlic. So we'll first finish the diets, the nutrition. Okay.
Yes. I think what we need to add is that they contain vitamins. They contain micronutrients.
Very true. Yes, some
like
contain
vitamin C. Some of them,
C,
like vitamin C,
other types of vitamins,
like zinc, like those what should I call them? Micronutrients that are very, very beneficial and helpful in terms of repairing the lining of the nose, the lining of the mouth, the lining of the digestive system.
So it kind of helps repair the body.
Yes, it helps repair the body.
So in a way, it has a role.
In a way, it has a role, but it does not target the virus, and it will not kill the virus.
Yeah.
But it can help you recover.
Yes,
from
it
the
can help you recover. It helps you recover faster because we all know that vitamins are very, very essential in terms of recovery from disease.
Everyone knows for flu or cough, just take your homemade remedy of vitamins and the likes, and then you get well. So even zinc. Yes.
So we know, remember, when we have, especially children with diarrhea, we give them zinc because we know that zinc helps to repair the lining of the gastrointestinal system and therefore help them get better faster from diarrhea. So there is some role in body repair, but not a curative role.
Of the virus.
Yes.
So the virus, the body, for most viral infections, the body basically removes the virus by itself.
Yes, it's very, very important for an individual to maintain good health and good nutrition and good immunity.
Good immunity.
Because the body's immunity, your immunity as an individual has a big role to play in fighting this virus and getting it out of your body. So it's important that in our daily lives we eat a balanced diet, we eat a lot of vitamin-containing foods, and we maintain a healthy body through physical fitness. Remember, mental health is also part of health. Yes, adequate sleep, reducing sleep. We know that an adult should have at least between 7 to 9 hours of sleep, and that is good sleep. And that helps the body to regenerate, produce fresh cells, and get rid of diseased cells, and also get rid of any disease-causing organisms like this virus.
Well explained, Professor. So now the golden question is, does chloroquine treat COVID-19? Does chloroquine treat the virus? There are lots of debates around the world. Famous presidents have come out to say chloroquine treats. But what is I don't know. People are really confused about this. Some people have gone to buy all the chloroquine in the market and finished it, saying that they will take it to prevent the corona. Is that a myth or a fact?
So
Dr.
I think we're
Christine.
still going to find out. There are ongoing studies. I think on chloroquine there are probably about 7 different studies. I'm not sure how many there are now. But one of the reasons why, I think there was a study that demonstrated that taking chloroquine makes people makes the virus take a shorter time in multiplication in the body. So you're less likely to be coughing out the virus when you take chloroquine. So I think they showed that if you take chloroquine, your time of infectivity is shortened.
Like
So
the time to infectivity?
your time of producing, kind of coughing out the virus. Or
Viral shedding.
producing the virus
transmission.
in your cough or
Okay.
your secretions is decreased by taking chloroquine. However, another study came up and said that there was no effect, there was no difference in time of recovery in people who took chloroquine and those who did not take chloroquine. But many of these studies have been done in a rush. Patients have not been, we usually prefer to use randomized trials. Like these are properly done clinical trials. And because of the way COVID...
What does a randomized trial mean?
So a randomized trial is where you actually, a person who joins the study has an equal chance of getting the drug of your intervention drug or non-intervention drug at the time when they're coming into your study.
So kind of compare two groups of people.
You're comparing two groups of people.
One gets the drug X, the other gets another something else.
Exactly.
So you want to see, is the effect of the drug more
in the
in
people who
get
have
the
the
drug?
drug and the people who don't get the drug. So you're comparing the effect in two people, in the group of people who have the drug and the people who are not getting the drug. So we don't have large studies that are
to
done.
tell us that indeed the chloroquine has effect.
Exactly.
Okay. So what advice can we give for people who have bought chloroquine?
Okay, so as Dr. Sekaja rightly says, we are in a state of, in science we call it equipoise, where we do not have strong data for use of chloroquine and hydroxychloroquine, or data against use of chloroquine or hydroxychloroquine. As she has described rightly, some studies showed some benefit, other studies have shown that it has more side effects and therefore more detrimental to the human being. But because we don't have a confirmed cure for COVID-19, and also because some research has showed some benefits, while others has shown while other research has shown worse effects using these two drugs, we are still in a state where we do not have adequate information, as scientists and as doctors, we really rely on evidence-based medicine. So we don't have good evidence for or against the use of the drugs. But we know that organizations like WHO, like the CDC, have said if you're to use these drugs, you could consider using them on a compassionate use because you don't have another option. You don't have a cure. So for example, Dr. Wachi, if you came to me today with COVID-19 and you're sick, you're in my hands, then I'll tell you, you know what, there's no cure. It's basically supportive treatment. But there are some drugs that have shown some benefit in some studies and some drugs that have not shown benefit in other studies. So what would you mind me giving you these drugs that have shown a bit of benefit? And it is really you to decide to say,
it's a patient to decide.
Yes, maybe give me those drugs. Okay. So compassionate use.
So shouldn't just also give out the chloroquine?
No, the recommendation so far is that you can also use it in research, like Dr. Sekaja rightly described, in randomized controlled trial in research, because research is a controlled environment. You're going to monitor these patients, and once you see that the drugs are causing more harm, you'll immediately stop.
Right.
And you can also use it for hospitalized patients where you have
the ones
monitoring facilities, even the mild ones, because as Dr. Seka just said, chloroquine and hydroxychloroquine from time immemorial have been shown to have some antiviral properties. They stop the virus from multiplying, and therefore they'll stop the individual infected from shedding a lot of virus. But they also have immune modulatory effects. They change the immune system.
So and it might also be worsening the effect of the ability of the body to fight the virus, I think.
They
in a
may
way.
help because we know that once somebody is infected with the virus, the body reacts by producing certain chemicals that cause more disease. Cytokines, yes. So chloroquine and hydroxychloroquine have been shown to have some immune effects that prevent, that lower that effect from the chemicals produced by the body that actually cause the disease manifestations. So basing on those two,
a hot area for research.
it's a hot area
Very
for
hot
research.
area, and we hope
Yes.
our authorities and the governments can invest more in research in the local context. So maybe this is a call for the officials to increase funding to our research institutions like universities, so that we can answer some of these questions of whether chloroquine indeed treats COVID or not in the Ugandan setting. Why we can, if the means are veiled, the funds are veiled, probably it would be a very good thing to explore. Yeah, right. So after the break, more about treatment. Is oxygen the same as a ventilator? Well, people are wondering which is which. Some people say if you have COVID, you're going to require oxygen. Does that equal someone who is dying? Or you're going to require a ventilator. Is that the same as being on oxygen? Well, lots of these myths coming up. We're going to address each one of them. Don't go away. We'll be right back.
You are watching the Doctalk Show.